Hi, my name is Wyatt Floyd. I'm a licensed independent Medicare broker with Seniors on Medicare, and today we are talking all about Medicare. In this video, we're going to show you a few things. We'll show you how and when to enroll in Medicare. We'll tell you about a situation where you can delay enrolling in Medicare. We'll break down parts A, B, C, and D of Medicare. And finally, we're going to review choosing a plan that works for you. I want to start by telling you just a little bit about who we are at Seniors on Medicare. We're a small independent broker that deals with Medicare specifically. That's our specialty. So our job is to help people with enrolling in Medicare, help them understand their coverage, the costs of Medicare, and we work with a number of insurance companies. So whether it's an Advantage plan, a supplement plan, prescription drug coverage, whatever it may be, we can help you with choosing one that meets your health and financial needs. And our loyalty is to you and not to any one company in particular. But that's not why you're here. You're here to learn more about Medicare, so let's talk more about that. Medicare is a federally funded health insurance program in the U.S. primarily designed to provide coverage for individuals aged 65 and older. It also extends coverage to certain younger individuals with qualifying conditions. Now, there are four main parts of Medicare which you may already be aware of. There's Part A, which you can think of as your inpatient hospital coverage. It covers a lot more, which we'll go into more detail on in a bit. There's Part B, which you can think of as your medical insurance. Part C is known as Medicare Advantage and is an alternative to original Medicare. And then there's Part D, which is prescription drug coverage. Now, again, we're going to talk about each of these parts in a lot more detail in just a bit, so be sure to stick around. Once you go on Medicare, it can truly be some of the best health insurance you've ever had. My business partner, who is currently on Medicare, only pays a $240 deductible once per year, and that is it. His expenses are done for the year. He has no out-of-pocket costs, no networks, no pre-authorizations. So if you choose the right plan, it really can be great health insurance. We're going to talk a lot more about choosing a plan like that at the end of this video, so please be sure to stick around. Now we're going to talk about when and how to enroll in Medicare. So for a typical enrollment, you'll either automatically be enrolled or have to go in and enroll yourself. So for those of you that are already on Social Security and getting Social Security benefits, you will automatically be enrolled in Part A and B of Medicare upon your 65th birthday. A few months before that, you'll get a packet from Social Security where you'll get a lot of information about Medicare and your coverage, but you'll also see the option to delay enrolling in Part B. And I want to caution you, for some of you, that's going to be a really good idea. For some of you, it's going to be a terrible idea. More on that soon. But for the rest of you who need to go in and enroll yourself, you're going to do that during what's called your initial enrollment period. It begins the 3 months prior to the month that you were born and lasts a total of 7 months. So as you can see here, this is the month you're born. It starts the 3 months prior and lasts a total of 7 months. After that, that window is up and you could face some penalties if you wait later to enroll in Medicare. Now, when your coverage actually starts depends on when you sign up for it. So if you sign up before the month that you turn 65, then you will get coverage starting the month that you turn 65. However, if you wait until the month of your birthday or during the 3 months that follow that, then your coverage won't start until the next month, whenever that is that you sign up. Now, there is one exception to that. If your birthday is on the first of the month and you sign up prior to your birth month, then your coverage will actually start on the first of the month before the month that you were born. So if I was born on April 1st, then my coverage would start on March 1st if I signed up prior to my birthday. So now we'll talk about how to actually enroll in Medicare, and there are a few options available to you. You can do it online, you can do it over the phone, or you can go to your local Social Security office if you love waiting in uncomfortable chairs for unknown periods of time. But in all seriousness, the option I recommend is doing it online. It really is simple to do, and if you're not the most tech savvy of people, then I have a tutorial video that guides you through the whole process. You can find a link to that video down below in the description of this video. So what you'll do is you'll go to the ssa.gov/Medicare site, you'll click the blue Sign Up Now button, and then you'll create an account and begin your application. Once you've completed your application, you can log back in and check your enrollment status. Once you've been enrolled, you'll have access to your Medicare number. In a couple of weeks after that, you'll get your red, white, and blue Medicare card in the mail. On that card, you should see your effective date. Pay attention to that because that's when your coverage actually goes into effect and you can begin using it. Most people turning 65 will enroll in both Parts A and B of Medicare, but some people out there will have the option to delay enrolling in Part B. If you or your spouse are continuing to work past 65 and you work at an employer with 20 or more employees, then you have that option to delay enrolling in Part B and you won't face any penalties when you sign up for it later. Now, whether or not you should delay in Part B depends on a number of factors. I have a video that goes into detail about whether or not you should do that if you fall into that camp, and whether or not enrolling in Part A and B is required when you turn 65, so please be sure to check that out. I'll be sure to put a link to that video in the description down below. So now we're going to talk about the 4 parts of Medicare. And just as a reminder, those are Part A, which is hospital insurance, Part B, which is your basic medical insurance, Part C, which is Medicare Advantage, and then Part D, which is your prescription drug coverage. Now, as we talk about each of these, we're primarily going to focus on the coverage, what each of these parts of Medicare actually covers, and then the costs, things like your deductibles, things like your co-insurance, max out-of-pocket limits, things like that. So let's go ahead and dig into each of these. There's a lot of detail here, so bear with me. I'm going to do a little bit more reading off the slides than I'd like, but it's important that we don't miss anything. So the first thing that we're going to talk about is Part A, which is your hospital insurance. And hospital insurance, or that Part A of Medicare, covers a variety of things. It covers your inpatient stays at the hospital, stays at skilled nursing facilities. It covers some nursing home care so long as it is not long-term or custodial care. It covers hospice and some home health care. In terms of your premium, so long as you or your current or even your former spouse have worked for 10 years or 40 quarters and paid Social Security taxes, then you qualify for what's known as premium-free Part A, which means that you do not have to pay anything from month to month to keep your Part A coverage, which is pretty nice. But there is a deductible, and the deductible for Part A works a little bit different than a lot of other insurance you may be used to. It's on a per spell of illness basis. So essentially the way it works is like this. If you go into the hospital for one illness, then you are going to pay your deductible amount before your Part A coverage kicks in. And in 2024, that deductible is $1,632. After that, your Part A coverage kicks in and you are using your Part A of Medicare insurance. Now, let's say that you leave the hospital and then you go back in for some new illness or injury. Well, your deductible resets, even if it's within the same year. And that's what that per spell of illness means. Now, even if you go into the hospital for the same condition, but you are out of the hospital for a period of time, that deductible may reset as well. So long as it's after a 60 consecutive day period of being out of the hospital, even if it's for that same illness, then your Part A deductible will reset. So that's important to know. So now let's talk about some of the Part A costs. So for your hospital inpatient stays, for days 1 through 60, you're going to pay $0 out of pocket after your deductible has been met. Once you get to days 61 through 90, then you'll be responsible for a $408 copay each day that you are in the hospital during that 61 to 90 day window. After that, you are in what is known as your lifetime reserve days, and these are days 91 through 150. So if you are in the hospital for 91 consecutive days, then you're starting to run into these days where you are going to pay $816 out of pocket for each day that you are in the hospital. And this is just for those days 91 through 150. Another thing that's important to note about these lifetime reserve days is that they do not re-up. So if you were in the hospital for, let's say, 95 days, and then you leave the hospital, you go back in another time, sometime later on in your life, and you're in for an extended period of time again, let's say 100 days to keep it a nice round number, then you've used up 15 of your lifetime reserve days. Now, you can probably do the math quickly to yourself. You have a total of 60, you use up 15, now you're left with only 45 for the remainder of your life. And also, if you use up all of those lifetime reserve days anytime you're in the hospital after 90 days, you're going to pay all costs. Don't worry though, if you're concerned about this, there are some additional coverage options available, both through Part C of Medicare as well as through some of those supplement plans that I mentioned earlier in this video. So there are some options available to you. Up next, we'll talk about skilled nursing. For days 1 through 20, again, it's going to be a $0 copay after your deductible has been met. Days 21 through 100, it's going to be $204 per day. And after day 100, you will pay all costs once again. And again, just note that anytime you see a $0 copay amount, that's going to be after you've already met your per spell of illness deductible. Up next is home health care. Again, $0 for covered services. And then there is a co-insurance amount that you're liable for, which is just 20% of the Medicare approved amount for a durable medical equipment. That's DME, it's stuff like wheelchairs, walkers, hospital beds. So if you're at home and you need some of those items, you'll be responsible for 20% of the cost of those things at the rate that Medicare sets for as long as you use them at home. And then finally is hospice care. You'll pay $0 for covered services, and then a copay of up to $5 for each prescription drug and other similar pain relief or symptom control medications that you may take during that time. And then you'll also be responsible for 5% of the Medicare approved amount for any inpatient respite care. So those are your costs for Part A. Now we'll talk about Part B, which is what you can think of as your basic medical insurance. It covers a variety of things. It covers doctors' visits, preventative care. It covers some prescription drugs, outpatient surgery, meaning that you go into a hospital or other surgical facility and you are sent home that same day, diagnostic tests, home health care, hospice, and some of that durable medical equipment, your DMEs. The deductible for Part B works like a normal deductible. It is paid off once per year. And in 2024, the Part B deductible is $240 per year. Then you run into your premiums, and for most people, you're going to pay a $174.70 premium, though some will pay more, and that's going to be adjusted based on your income-related modified gross income. So here's this table that you can take a look at. I'll leave it on the screen for a moment. If you fall into one of these camps where you are, your modified adjusted gross income is this amount, then this is what your premium amount is going to be for Part B from month to month. So let's move on to your co-insurance. Again, for Part B, it's mostly going to be 20% for Medicare covered services. that's what you are liable for once you meet your deductible. So for clinical lab services, it's going to be $0 for covered services. Home healthcare, $0 for covered services, and then 20% of that coinsurance for your DME, that's durable medical equipment like wheelchairs, stuff like that. Inpatient hospital care. Now, I know you heard me say that Part A is your inpatient, but when you're in the hospital, sometimes you may see a doctor, a specialist, orthopedist, whoever it may be, and your Part B is actually going to cover some of those services. It's going to be a 20% coinsurance payment for you. For outpatient mental health care, it'll be $0 for a yearly depression screening, and then 20% for other visits to diagnose and treat your conditions. Just note that if you get your services in a hospital, you may have to pay an additional amount to the hospital for those services. For any partial hospitalization for mental health care, your coinsurance amounts, once again, 20%. And then for outpatient hospital care, it's usually 20%. And you'll also pay a copayment to the hospital for each service you get in a hospital outpatient outpatient setting, except for some preventative services. But in most cases, your copayment won't be more than the Part A hospital stay deductible amount. So that is your Part B costs and coverage. Next, we'll talk about Part C, which is also known as Medicare Advantage. We're going to define it really quickly here and just really briefly touch on it, but we'll go into a lot more detail about some of the differences and pros and cons of going on Medicare Advantage versus going the traditional Medicare route later on in this video. So please check that section of this video out if you're considering this as an option. So what Medicare Advantage is an alternative to original Medicare, and it's offered by private insurance companies that are approved by Medicare. So if you do go the Advantage route, Medicare is no longer your primary insurer. Your primary insurer would be whichever Advantage company you go with. So Medicare is your primary insurer when you're on original Medicare. Whichever company you go with is your primary insurer when you're on Advantage. And that comes into play when you're considering different doctors to see and whether you're in network or out of network. We'll talk more on those differences later. But Part C plans must cover everything that's included in Parts A and B of Medicare, but also offer some additional benefits like vision, dental, and some prescription drug coverage. There are a variety of different types of Advantage plans out there, and your premiums and other costs like deductibles and co-payments are really going to vary depending on the plan that you choose. Now, with Medicare Advantage, these amounts can and will change from year to year. Also important to note is that you must have Part B and keep paying your Part B premium in order to stay on your Advantage plan. Once you select an Advantage plan, there are only a couple of times per year when you can make changes to your plan, and that's usually in the fall during the annual election period and then at the start of the year during open enrollment. Not going to talk a whole lot about that in this video, but just know that if you go the Advantage route, that's something you will need to pay attention to yearly because it can and will change yearly. All right, and last but not least is Part D of Medicare, which is your prescription drug coverage. So with Part D, it covers most outpatient prescription drugs. And similar to Part C of Medicare, it's offered through private companies, either as a standalone plan for those people who choose to enroll in just original Medicare, which is Parts A and B, or it's offered as a set of benefits that's included with your Medicare Advantage plan. So similar to enrolling in Part B or enrolling in Part C, you're going to have to do this on your own separately from your original Medicare enrollment. And unless you have what's called creditable drug coverage, and are going to enroll in Part D at a later date, then you should enroll in Part D when you first become eligible for Medicare. If you delay your enrollment, you could face gaps in coverage and enrollment penalties that will last the lifetime of your coverage. So I'm sure a lot of you are wondering what that penalty is. Here it is. Medicare will calculate that penalty by multiplying 1% of whatever the national base beneficiary premium is, which is $34.70 in 2024, times the number of full uncovered months that you didn't have Part D coverage. And then that is going to be rounded to the nearest 10 cent and added to your Part D premium. And that's going to last the lifetime of your Part D coverage. So be sure to enroll in Part D when you enroll in Medicare, unless you do have that creditable drug coverage. And if you're wondering whether or not your coverage is creditable, then you can just give your current provider a call and they'll be able to tell you whether or not it is. And most are, but just be aware of that. So what Part D covers, again, really is going to vary by plan, but it mostly will depend on the drugs that you take, where you live, and the plan that you choose. So that's really going to influence the cost of your plan. Now, each Part D plan has a list of covered drugs called its formulary. And if the drug that you need is not on the formulary, you can make a request for an exception. You can pay out of pocket, or you can file an appeal to get that drug covered. But for the most part, when you're enrolling in Part D, you'll be able to type in the drugs that you are currently taking, and most of those drugs likely will be covered by one plan or another. So all Part D plans have to cover at least 2 drugs from most categories of types of drugs, and they have to cover all drugs that are available for these categories. So all drugs are covered for HIV or AIDS treatments, antidepressants, antipsychotics, anticonvulsive treatments for seizure disorders, immunosuppressive drugs, and anti-cancer drugs, unless those are already covered by Part B. Now, Part D plans must also cover most vaccines, except for any vaccines that are covered by Part B, and there is an exception to some drugs that will not be covered. So Medicare does not allow drugs that are used to treat weight loss or gain. It doesn't cover any over-the-counter drugs, and some others that are explicitly excluded by Medicare by law are not covered under any Part D plans. That's just the way that it is. So those are the things that are covered in Part D, and again, I can't really speak to the costs because it's mostly going to depend on the plan that you choose. As you get ready to enroll in Medicare, there are a couple of really important decisions that you're going to have to make. Now, you can choose to enroll in Original Medicare or to go the Advantage route. But either option that you choose, you're going to need to enroll in both Parts A and B, and you're going to continue paying your Part B premium, even if you're on an Advantage plan. But let's go ahead and start with the Original Medicare route. So if you choose this option, you're going to enroll in Original Medicare, and Medicare is going to be your primary insurer. And what that means is that you can see any doctor that you would like so long as they accept Medicare. There are no networks, which is a really big perk and a big reason why a lot of people choose this route. The next decision you're going to have to make is whether or not to enroll in a supplement plan, and this is something that a lot of people do. Supplement plans are offered by private insurance companies, but they're federally regulated, so regardless of the supplement plan you choose, it's going to be the same from one company to the next. This is a really attractive option because they fill most of the gaps of Original Medicare, and there are some supplement plans out there where after you pay your monthly premiums and your Part B deductible, you can have little to no out-of-pocket expenses for using your health coverage. Now, there are some important things to note about supplement plans. The most important is that there is only one open enrollment period, and it starts when you first go on Part B of Medicare and lasts for 6 months. After that, your open enrollment period to choose a supplement plan is up. Once you're outside of that open enrollment window, you are going to have to go through underwriting in order to be approved to be issued a supplement plan. So you're no longer guaranteed to get that supplement plan if that's an option you are interested in. Companies can ask you health-related questions and use that to approve or deny you coverage. So make sure you sign up for a supplement during that open enrollment window if that's something you're interested in. The next thing you're going to want to do is enroll in a Part D plan, and these are your prescription drug plans. You want to enroll in these when you're first going on Medicare, because if you don't enroll then and you enroll on down the road, then you could face increasing lifetime penalties the longer you wait to enroll. So definitely get that taken care of. Part D plans are offered by private companies, and they do vary quite a bit from plan to plan. The way that you're going to want to shop these plans is by using the medications you're currently taking. If you just go to Medicare.gov, you enter in those medications, then a lot of different plans will pop up and you'll be able to compare the benefits and costs of each of them. But just know some plans are available for as little as $0 a month, but they can be anywhere from $30 to $50 a month depending on the drugs you're taking and where you live and some other factors. Now, something else that's pretty important about these plans is that the plans may change from year to year. So you're going to want to take a look back at them during that open enrollment period where you can make changes to your Part D plans. Once you've reached this point, you are finished with your Medicare journey, but there is another option to consider, so we'll talk about that next. The other option to consider is choosing an Advantage plan. Now, Advantage plans are managed by private insurance companies. So if you go this route, then Medicare is no longer your primary insurer. It would be whichever company you signed up with. Now, there are a variety of companies that offer Advantage plans and a variety of types of Advantage plans available, but the most common are your traditional HMO or PPO plans. And with that, that means that there are networks that you are limited to for the healthcare providers that you're able to see. Now, you can always go out of network, but that'll be more out-of-pocket cost to you depending on the plan that you sign up for. Additionally, the costs and benefits of each of these plans are going to vary quite a bit as well, but they must cover at least all of what's covered by Part A and B of Medicare. Now, some of these plans have costs as low as $0 a month for your monthly premium, but you're going to see a lot less covered on the back end of things when you actually go to use that insurance. You're going to see a little bit higher co-pays or co-insurance depending on the service that you are using that Advantage plan for. So my biggest tip for you is just make sure you really read through those costs and benefits so you understand exactly what's covered, what's not covered, and what the costs associated with that coverage is. Now, as I said before, with an Advantage plan, Medicare is no longer your primary insurer, and it's now whichever company you go with. So that company is going to be in control of dictating how you use your actual coverage. In a lot of cases, you may need pre-authorizations before undergoing certain treatments. However, these plans do offer a lot of additional benefits oftentimes. They may cover things like prescription drugs, vision, dental, and may offer some extra perks as well. Advantage plans can and do change annually. So while your doctor may be in network one year, they may be out of network the next. The same is true of your coverage benefits and the monthly premium you pay. So it's important to keep up with your Advantage plan annually. Once you're on an Advantage plan, the only time that you can make changes to your plan is during the annual enrollment period from October 15th through December 7th, or during open enrollment from January 1st through March 31st. So you'll want to make sure you keep up with this coverage from year to year if that's the route you choose. When you're deciding between Original Medicare or going with the Advantage plan, there are a few important things to consider. Firstly, if you start off on Original Medicare with a supplement, then you can switch to an Advantage plan at any point in time and you are guaranteed to be issued that plan. However, if you start out with an Advantage plan and then later want to switch to Original Medicare with a supplement plan, you're not always guaranteed to be issued that supplement plan unless you're able to qualify through that underwriting process and answering those health history questions. When you're choosing between these two options, you're going to want to consider some of the basics. You want to consider your health history, what your monthly budget is, how often you're using your medical coverage, and then of course, what you're looking to get out of your plan. Now, I know this all may seem a bit confusing, but you are not in this alone. Again, my name is Wyatt Floyd. I'm a licensed independent Medicare broker, and what I do on a daily basis is I help guide people through the Medicare process and choose a plan that works for their health and financial needs. Now, as an independent broker, I'm not beholden to any one particular company. In fact, we work with a variety of different insurance companies, and our services are always free for you to use, whether it's claims help or whether it's reviewing our clients' plans annually to make sure they're never overpaying for their coverage. We're always here for you, so just give us a call. You can visit our website. And if this video was helpful to you, please be sure to like and subscribe to our page for more useful Medicare tips. Cheers. Have a great one.